Welcome back, and thanks for staying with us here on The Pulse. So the race against time is on. By this Saturday, we are yet to experience another hike in fuel and LPG product hikes. And already we know that many of you are trooping to the fuel pumps to either fill your tanks or get barrels of it, waiting that price hike. We also know that that government intervention where the reduction or the removal of the stabilization and recovery levy on fuel products is supposed to kick in. But we've been told that Parliament will have to reconvene for that to happen, even though the minority have already said that is not the case. But we'll be getting into the details of this particular hike, visit the fuel pumps and hear from COPEC on this particular development. But first, we can hear from the Chief Executive of the Oil Marketing Companies, Kweku Ajimandua, who's been interacting with Evans Mensah on PM Express.
Oh yeah, the trend is showing that way. You know, we don't know what will happen tomorrow. I mean, like Ngudu said earlier on, prices are so volatile. If it does, it's 7%, it's going to be increased. Definitely, it's something we have to pass.
Okay, so when should consumers expect that increase to reflect at the pumps?
Basically, it's the end of the window, the beginning of the next window. Normally, that's how we work.
So the next,
but then that we sorted out procedurally. Obviously, we can just get out the public may not be that much.
Yeah, I mean, I can guarantee you that. When is the next price window, and the beginning of the next one?
We are just ending the 15th, then we start on this.
On the 16th, so this will be Saturday morning.
Yeah.
This will be Saturday morning.
So that's the situation. By Saturday morning, you should be expecting the 7% increment to kick in at the pumps. Also on the same show last night, ranking member and spokesperson of the minority when it comes to energy issues, John Jinapo, mentioned that the government ought to let us know how much exactly has accrued in the Stabilization Fund and how they are hoping to expend that. We can listen to him.
So that means that you are not reducing the prices now.
No, yes.
And that until Parliament resumes on 26th, the minister then has to lay the document. It is referred to the committee goes to deliberate, brings it to the plenary approves, and it's only 2 months. Is that not what they want to do?
2 months, yes.
So the first thing is that the MPA should tell us how much do we have in the price stabilization levy. The essence of the price stabilization levy is to accumulate money so that when there's an increment like we are expecting, you can fall on that money to cushion consumers. So they don't need to even tell consumers that we are suspending, withdrawing, or whatever with the price stabilization. The price stabilization is supposed to be accumulating money. And when I checked from the energy sector levies account, there's so much money in that account. It's unfortunate that I'm at a program. That's why I said I wish I was there. I would have pulled all the figures. Because we are talking of hundreds of millions of cedis, which can cushion consumers for a considerable period of time before Parliament resumes and decide whether to suspend that tax component or not. Because it's a tax. It is the Energy Sector Levies Act. So I'm surprised that the MPA says that they are waiting for Parliament to resume. So I'm asking that MPA, how much do you have in the price stabilization levy? And how many weeks, days, or months can that amount cushion consumers? I think we should answer that question.
And so we are learning at the last check that the Stabilization Fund, in terms of how much is accrued, is over 400 million. And that's what we know. But it remains to be seen what exactly the Finance Ministry's response or reaction to this is, because the NPA has mentioned that that 2 months removal of the Stabilization and Recovery Levy will not kick in anytime soon unless they get a parliamentary approval, even though the minority says that will not be the case. But many of you have been reacting. Consumers, it affects you, it affects me. And what exactly are your thoughts on that? We've been handing over the microphone to some of you. Listen to your views.
In view of what they've already proposed in increasing the LPG gas, we would like to plead with the government to do something about it, because with the standard of the living now in Accra, it's getting higher. and with the payments of people's not being increased and salaries not being increased.
To me, I think it's going to worry us a lot as the consumers, because whenever things are being increased, it affects lives a lot. So that is my little opinion.
In fact, the fuel price has affected everything basically in Ghana. Since the transport, it has affected the transportation and marketers. Everything that we do in Ghana depends on transport. It's a very bad thing, and I don't encourage that the fuel price should be increased. I think that it should rather be decreased, so as we will feel them in our pockets and in our lifestyle.
I'm a driver as well. I'm a commercial driver too, because nowadays things are not well. Things are not going well at all, because now the system is hard to the extent that if you go to work, you buy fuel roughly now. Fuel is roughly now 28, 29. So we take it at 30 cedis for a gallon. So if as a commercial driver want to use 4 gallons a day to work, is roughly 120. And 120, how are you going to work with 120 before you get your daily sales, before you get something home? So increase of the fuel, we are not agree with it. So we are pleading to the government if they can do something about it, so that the fuel price will come down. So those we are in the system now will help us, so that the passengers too can get money and take buses to wherever they are going. We people who are driving cars too will be okay.
I'm just pleading to the government to reduce the fuel price, because now it's not easy. Because of the fuel price, we are suffering so much. Because now, if you buy the fuel within a short time, or you will not even get your money.
Once we vote, for once we believed in the government and we give the government the authority we have, he has the right to also think of us and do what will benefit the citizens, so that there will be free and there will be peace in everywhere.
The increment should be memorized for us, because a lot of people can't afford to buy the gas. So I would just tell the public that they should think about this and then help the traders who go and then buy gas for cooking and even to the vehicles, etc.
So if you didn't know, by Saturday, 16th October, fuel and LPG products will go up by 7%. And already, transport operators have served a notice to government that they will be forced to increase transport fares by 20% if a number of levies on fuel products are not either scrapped, merged, or reduced. And they've served that notice. They just were short of giving timelines, but it's just emerging also that by Saturday, we're getting a 7% increment on that. My colleague, Manuel Kranting, has visited a number of fuel stations. Right now, he's stationed at the Guelph filling station at Nima, and he joins us live with reactions at the pump. Manuel, fill us in on what exactly it is you've noticed since you've been to the filling station today.
So you can see the activity behind me. Quite a number of vehicles are trooping in here to get their tanks filled. Indeed, from off-air interactions that I've had with them, the price have been consistently in the past couple of weeks been rising. And the attendant here just told me that just at the start of this week, a liter was going for 6 cedis, 50 pesos. Today is at 6 cedis, 52 pesos. And with the announcement of a possible increment by the weekend, indeed there are concerns about this this price quotation actually even moving further from where it is now. I'll try and just move briefly and speak to a few of the customers here who really have I've had the cause to, complain about the prices. My boss, briefly, good afternoon. You're live on a pulse on the JoyNews channel. Grateful. I see that you're rushing here trying to fill your tank. Have you heard of impending, fuel price hikes?
Yeah, I read about it. I was told there is a 7% increment, and this is what we expected. This is not what we were expecting from the president and the vice president. They told us everything is going to be as we think it's going to be. I don't know what is happening now. You know, every single second before you hear, they are going to tell you we are increasing your fuel and then the taxes. I don't know what they are doing. Mr. President need to do something about it. You understand me? This is all I can say for now. You understand me?
And so, MFI, you heard him there. He's one of the concerned, of course, patrons here. I'll try and speak to the attendants and speak to even some more people who are buying this afternoon. Grateful, sir, if you could speak to us just briefly. We see a lot of activity here in your yard. You're live on the JoyNews channel. We see a lot of activity here in your yard. Tell us, is it a number of people who come here every day? Just briefly, is this a carrying number? Of course, the normal number that you see, the activity that we are seeing here.
Like the number?
Yeah, you can find Barbeto petrol wahano. I say ne akosro. And I say sana debia and Kofobeto. Sa debia. Sana debia. But you say debia na mo full on the price no cost. You say by weekend na 7%. So abekao.
I'm meeting sir.
Now customers no beto. Amune mo nkasa den mo catch them.
I will complaining.
And so you're seeing, of course, the place is quite busy, and so he's not getting so much time to speak to me. What's your complaining? I don't know. Catch you.
Catch you and say, I'm fear her.
Okay.
I say, I buy a baby fan whom I say, like, I'm back from Kakra.
Okay. All right. And so he's saying that indeed he's been getting the concerns that you've been hearing some of the customers share this afternoon with us. They share them with him as an attendant even here at the Nima Gore filling station. He says that for them there's not much that they can do, and as you heard him say in Tree, it's a matter of government policy and so on and so forth. Let me try and speak to this gentleman here and try and find out if he's able to speak to us. Grateful, sir, if you could speak to us just briefly. We're live on the JoyNews channel. Indeed, he's not able to speak to us, but I see this truck driver approaching who would speak to us briefly on the channel. Master, good afternoon. Yeah. Yes, I'm saying more for no. I say Obeko pump beer na for no price na cost.
Ni dem mo anutu enu na e wo no.
Na e ba ne say.
Ayenti mi chiro.
Mutumi che.
Da bi ande e to onyame ma ye na ento. Why?
Say price no cost ro sa na mama passengers for no na etua na.
Ya na etua ya ade e.
Wa na mutia. Okay, and so he says that they pay it on their own, but say na niama na cost no say price no cost ro sa na eventually mo be increase mo lose the bank.
You lose bibia.
What's the mo lose bibia? Na mo lose.
Boss mama go.
And MFI really has to be a bread and butter issue, and even as they complain about the hikes in the prices, you're seeing people want to rush about their daily business activities, so that, as you heard him say in Tree, the hikes affect the sales that they are able to rake in every day, and so they have to work extra hard to make up for the deficit that is created by the margin that is increased. And so indeed that's the activity. That's the activity really that we're seeing here at the Gore filling station at Nima. And indeed, I see a lot of Okada riders who are just across that end and buying. So I just want to speak to them also. And these folks, you get the sense that they buy in bits from different stations. My boss, good afternoon.
Afternoon.
What's your name?
My name is Abdul Karim Mahmoud.
Abdul Karim, tell me, what is the situation with your fuel prices?
We cannot say anything. It has already been increased, so there's nothing we can do.
But catch you. Debia mokotwa price no increase and I confirm. And I stable.
Stable.
Okay. For how long ne?
Like I say, for about 2 weeks now. It's normal But for today, I don't know.
For today, you don't know.
Yeah.
But I say by Saturday now, I increase it by 7%. What you know?
I know that I'm Shadan. Man.
The price increase by 7%. A bit affected.
So increase the a bit affected, especially we so Okada no be affected.
How?
We thought 20 cities. At first, 20 cities. It lasts from morning to around, let me say, 4. But now, if you buy 20 cities from here to Mamobi, unless you come and buy a new one, so at least always your tank has to be full.
You say what? You talk something. I won't hear you.
I say, look at petrol intensity. It's too high. Therefore, reduce the petrol for us. We don't know what is going on.
So this one be how much?
10 cities with that. Look, like pure water. But we pray for God. Maybe God help them to make them see what is going on to the country to help the country.
They say by Saturday now it go up again by 7%. That one how you go do am?
We can't talk. If we talk, our talk is not a right way for them. So what they want is what they're doing.
So what do they want to make the government do help you?
The government for what is right. The government for what is right to do right.
The right, what be the right thing? No?
But we like this. Them they are different than us because if them go, the education they have done our own be different. So them for know what is the meaning of the education they have, and they follow the way to do the right thing to the country.
Okay. So you don't want to make the price come down?
Inshallah, by grace of God, if you come down, we shall, alhamdulillah.
Okay, thank you. And so these are some of the Okada riders who are here trying to fill the tank, and you saw him show me the gallon. He says that 10 Ghana cedis worth of fuel is almost like pure water. But generally, you're seeing a sense of increased activity at the fuel pumps, with a lot of them trooping in. The catch, however, is that most of them say they are left with no choice, because whether the fuel prices increase or not, they would have to still continue with their daily activities. And so the options available to some of them to work extra to make up for the shortfall, or just continue enduring it as they hope that government does something to reduce the prices as they are seeing at the various pumps. So MF, if you can hear me though, this is a situation that we have here at the Nima Goil filling station.
Well, Manuel, just before I let you off, by the way, let me find out, have you filled your tank already?
MFA, we are filling tonight. We are filling and filling all the rest that we have to fill.
That's my colleague Manuel Cranting reporting live from the Nima Goil filling station. He's been interacting with some consumers on the expected fuel increment, 7% increment by Saturday, effective October 16. And we're still waiting for when exactly that stabilization and a recovery levy that has been removed by the NPA, when exactly is going to kick in, when we've been told that they need parliamentary approval for that to happen. And we've told you also about a possible increment in transport fares. We're watching that, and we'll be hearing later on or subsequently from COPEC on this latest development, because it's been on for a while. We were told it was 6.50 per litre back then. Today at the pumps it's 6.52, and that is when we are still awaiting the increment on LPG and fuel at the various stations. We move on now at some point, and would definitely return to it subsequently, issues about fuel, because it's of interest to all of you. But you can share your thoughts with us. Tweet at us on Twitter, is at the hashtag The Pulse, and then also on Facebook and all our platforms. You can leave your comments there as well. And on to some other issue also that is of interest to public sector workers. You know, the Controller and Accountant General's Department had mentioned that no NIA card, no salaries by close of December. And they are maintaining that they will not back down on that December 1 deadline, given public sector workers to get the Ghana card or forfeit their salaries. Now, it comes as the minority and the National Association Association of Graduate Teachers as well as ICU, amongst others, are mounting pressure on government to review that particular deadline, insisting that the directive will help rid the public sector payroll of ghost names, fraud, amongst others. The Public Relations Officer at the Controller and Accountant General's Department, Cephas Adosu, says government will not review the timeline. We'll get to hear from him shortly, but first, let's bring in the Minority Spokesperson on Employment and Social Welfare, Dr. Kwabena Donko, who is raising red flags about that particular timeline.
Young worker on the controller's payroll has a contract of employment. That contract of employment does not involve the production of a Ghana card. And therefore, if administratively we found out that using the Ghana card can help us prevent fraud, which nobody in Ghana wants, if it can help us administer the payroll more efficiently, which we all want, that is a good thing. However, the methodology must also serve the interest of workers. Do all workers have Ghana card now? For those who don't, they now have to go and pay above 200 to obtain a Ghana card. That is fine. I look at the short-term diktat. This is a total diktat in a 3-week period. And I believe it is unfair. The employee at Zabziku, the employee at Kojobo for the Chamba, who has no Ghana card, cannot have a Ghana card within this period. And therefore, the Controller and Accountant General must leave some of these things, the engagement to elected officials, the Minister for Employment, there's the Minister for Finance, let them engage with organized, let them sensitize the population as to the need for this, and then we roll. But you don't issue a diktat and think because you are the Controller and Accountant body wish, even if it is that wish has a time period that is unreasonable.
Is it the case that you've heard from these public sector that they are unable to get this Ghana card, or is your view that there should be an extension of the deadline, or what exactly should it be?
That deadline is a misnomer. It's a poor start. Let the Minister for Employment, the Minister for Finance, and other elected officials, let them engage organized labor, let them engage other trade union representatives, let them engage the general public, sensitize us in sufficient time.
Well, the National Association of Graduate Teachers is also strongly opposing this directive. We're going to hear from President of the association, Angel Kabonu, who wants the Controller and Accountant General to retract this particular directive.
It is unacceptable for the government or the controller to tie anything at all to our salaries. As workers, there is a principle in labor relationship concerning compensation. Compensation is paid based on the work that you have done. Compensation is paid when there is injury to you in the job that you have done. Compensation is paid based on contractual agreement between the worker, which is expressed in the collective agreement. So you don't use the workers' compensation as a bait to push through policies. You discuss policies with workers and find ways and means of letting the workers understand the usefulness of the policy and getting them all on board, rather than coercing workers through force by the use of their salaries and threaten to push through policy by withholding workers' salary. You cannot do that, and that is unacceptable. This is not the first time this is done. Some time ago, they wanted to pay workers on the e-switch platform and threatened that any worker who fails to register with e-switch will not be paid. Workers will have to come out and complain and agitate against that for the policy to be withdrawn. And then they are doing the same thing with the Ghana card. Can they tell us the challenges that people have had in registering? A lot of people refused to vote, could not vote, because of the challenges they encountered when they went and registered for the Ghana card. In the Ghana card, you even had wrong spelling of names. Birthdays and so on and so forth have been wrongly imputed. So when you want to use, are you using the Ghana card to replace the staff identity card that the Controller and Accountant General is operating? So we don't accept this, and we want the Controller and Accountant General to withdraw the threat and engage workers within the confines of good labor practice.
So, Mr. Kabone, if I understand you, you do.
But it appears all these concerns are falling on deaf ears. The Controller and Accountant General's Department insists government will not review the timeline. We can hear from the Public Relations Officer of the Controller and Accountant General, Cephas Dosu.
I don't think we have made it any difficult for public sector workers to secure their cards. If I do recall, I think yesterday or so, I heard my colleague at an NIA, and among other things, he stated that they have about 34 registration centers and more were being added. So I think that NIA has positioned itself to be able to meet the demands of the of all. I just would wish that we would continue to urge each and every one to avail themselves and register and secure the card.
Let me ask you a concern that has strongly been raised by some of the workers, particularly the teacher unions, NATS and NAGRAT. So they say particularly that this is an independent fiat by the department. You have done 0 engagements with them.
I appreciate their concern, but we should also understand that the responsibility of protecting public purse is also on our neck. And I'm sure you also are aware that the issuance of the national identity card did not start from today. And so it is best that we all make an attempt to avail ourselves to secure the cards.
But your directive only came out this week.
Yes, it came out this week. But prior to this, for the past 4 months, Controller has been engaging public sector workers who have been involved in the nationwide training program for the HR and cost center validators. And we kept urging them that you need to sign on to the cards because we are in the process of aligning the two systems.
So having listened to the concerns raised already, do you intend extending the time? Because December 1st is just around the corner. We barely have 2 months.
Well, I think the first thing that we all need to do is that let's avail ourselves and attempt to register. If the deadline given comes up, we can then sit and review the system, review what the situations are, and if there's a need for us to make amends as far as the deadline is concerned, we would. But the e-letter just came out just this week. We have not even availed ourselves to see whether we could go through the process of registering for the cards. And we're only talking about the fact that the time is too short. I think we should first avail ourselves, register for the cards, then when the time is up, we can do a review and look at the way forward.
That's the PRO of the Accountant General's Department, Cephas Dosu there, sticking by that particular December 1 deadline that has been given to public sector workers. No Ghana card, no salary by December. Let me quickly bring in the Deputy Minister of Employment and Labour Relations, Mr. Bright Rekunbrobe. We're grateful for the time here on the polls, sir. So you've been hearing public sector workers. We've heard from some associations on this particular directives. We heard from the minority spokesperson on employment and labor. And then just this afternoon, also the controller. It appears that the timeline is of concern to all these public workers. But the controller says that December 1 deadline will never be reviewed. Really, is there an intervention that the ministry will be bringing in all this?
Yes, good afternoon to you and to your cherished listeners. What will happen is that we will engage controller. In fact, yesterday, when this matter came up, my minister asked that I do a follow-up and give him a report. I spoke to controller personally. I think in principle, workers even don't disagree with what they want to do. Everybody is appreciative. Everybody wants to get identified. We all want to remove ghost names. We want to do things right. But the timing is what everybody complains. So I spoke to controller. He's amenable for us to engage. And then we look at it and have realistic timelines for this. So every worker should be rest assured that controller has indicated his readiness to let us engage. And then we look at the pros and cons of it. And I'm sure that if we bring in the leadership of the unions, we are likely to get a win-win situation where we can probably look at the extension of time.
But shouldn't this engagement didn't have to happen earlier before the controller came out with the directive for a December 1 deadline? Is it that nothing of the sort happened before the announcement?
Well, I think there's no need crying over spilled milk. It has already happened that the directive has come. We could go back and then sit with them and look at the concerns that have been raised. And then following that, we can make a better way forward.
So, what should workers then expect in terms of this extension of deadline, and when exactly will that engagement with these workers happen?
Well, today is Cabinet Day, so all the ministers to take very crucial decisions on this, i.e., the Minister for Finance, my Minister for Employment and Labor Relations, they all have to sit and do this. So let's look at, because of the urgency of it, I'm sure if not tomorrow, early next week, we'll do something and come out with a communique.
And you say that in your interaction with the Controller and Accountant General, they are amenable to an extension of this particular deadline?
Yes, yes.
To when do we know?
Oh, no, that I can't tell. We all have to meet and then look at it. But like I'm saying, he's very amenable to us to have a conversation around it and then have a better way around it.
But of course, this concern also is about availability of the card, being able to get the NIA card. Are we also in talks with the NIA? Because we know that now they're saying if you missed the mass registration, you ought to pay up to 250 Ghana cedis. Is there going to be a concession for these workers?
I'm sure some of these issues will come up. Because for us in the Labour Ministry, this matter got to our attention. The most important thing that worries everybody is the timeline. So when we meet and other consequential matters come up, we will look at it holistically and then be able to address them.
Okay, so that's the Deputy Minister. We are grateful for your time, Deputy Minister, Employment and Labour Relations Minister, Bright Rekon Brobe there, speaking on that directive that has been given by the Controller and Accountant General's Department, insisting that the Controller and Accountant General is amenable to an extension of the particular deadline. We await how that will pan out. This is The Pulse here on the Joy News channel. We'll take a quick break. We're right back. This is The Pulse. You're welcome back. And thousands of Ghanaians, well, that's you and me, are either blind or with some form of visual impairment. This is not a fair story, but I'll go through it because today is World Sight Day. And on the pause today, we put the spotlight on that disturbing situation in the country. We've been inviting, we have today in the studio an ophthalmologist, optometrist to help us understand what we can do to protect our eyes. But first, let's take a look at the data from the Ghana Health Service on our video wall. So the Ghana Blindness and Visual Impairment Outlook, this is the 2021 figures. We have 227,920. That's a total number of Ghanaians that are blind. That's the figure. That's what it looks like. 227,920 total number of blind persons. And then also we have the related ailments, cornea-related diseases, 11.2%, the post-segment diseases, 12.3%, glaucoma, 19.4%, and cataract, which is leading, is 54.2%. That's what it looks like when causes of blindness. And then the number of persons suffering from visual impairment, 579,040. These are Ghanaians with moderate visual impairment, and 329,560 Ghanaians with severe visual impairment. That's the figures, number of persons suffering from visual impairment. And then with serious visual impairment, we have 300,000 persons. 300,000 persons in Ghana. And so that's how it looks like when it comes to issues about, eye, when we talk about World Sight Day today. And Collins Asmini is an optometrist. He joins me in the studio. I'll get my eye examined today on the pulse. Welcome.
Thank you.
Happy World Sight Day.
Yeah, thank you.
How come you don't wear glasses?
Well, I have one.
My producer, the director, everybody is wearing glasses. Yeah, they are all blind in different ways.
I like your frame. It's nice.
Okay, thank you. So, World Sight Day, what should we be pondering over on Saturday, you say?
Well, thank you. And I think for today, it's more of awareness. And if you look at the messaging from the International Agency for the Prevention of Blindness, IAPB, it's more about rallying communities around eye care. So more like we putting out the message out there, because I'm sure we'll talk about it. Glaucoma is a silent thief of sight. And it's said that if you don't check, you don't know. So the awareness is more about, at least once a year, go to your doctor or go to the eye clinic and have your eyes examined.
And it looks like it's the lead-in. We'll get to it, but as an optometrist, you've been, you've seen a lot of eyes. I don't know how many eyeballs you've seen in this year alone, but do you think that we are all taking care of our eyes as we ought to?
Well, sadly not, because I think there are cultural reasons to it also. A lot of people feel that if I don't know, it's fine. So instead of going to see the doctor, they would rather stay at home. And that for me is a problem. So we are more like talking to people, sensitizing the public that you may not feel anything, but just walk in and have your eyes examined.
Well, I don't know how many times you get your eyes examined, but we'll get into all the details that we put out. That Ghana Health Service statistics, very worrying. Glaucoma is leading. We have cataracts, and then we have the cornea, and amongst others. But we'll get into the details shortly. But last weekend, Vision Spring held a free eye screening for residents of Nima.
That's right.
We'll be getting into more of the conversation. But first, take a look at this.
As part of this year's World Sight Day, the International Agencies for the Prevention of Blindness, IAPB, launched a program to have 1.5 million eye screenings globally. Vision Spring, an active member of the IAPB, is committed to screening some 150,000 people across its 8 countries of operations, including Ghana. One of the many screenings scheduled for the country came off at the Nima Government Hospital on Thursday. Majority of the people screened reported cases of ocular allergies, an itchy eye condition which makes affected persons rub their eyes excessively. Also reported were refracted errors, a common eye disorder which occurs when the eye cannot clearly focus on images. This usually results in blurred vision and causes visual impairment. Affected persons received on-site spectacle tests and were prescribed pop-in eyeglasses. The pop-in eyeglass is Vision Spring's novel product that is fitted on-site and provide instant solution to refractive errors.
We had conducted a study among the tea pickers in Assam in India, and that study showed us that a pair of eyeglasses increases a worker's productivity by 22%. And that is a big number for someone earning, less than $4 a day. For someone earning less than $4 a day, over 2 years of wearing eyeglasses, that translates to more than $200. So that is a huge impact to someone's earning potential, and that's what we want to offer to this community at NEMA.
Again, presbyopia, the gradual loss of the eye's ability to focus on nearby objects, was reported among persons aged 40 and above. More than 40% of the participants needed reading glasses, and they were prescribed for free.
We have screened more than 45,000 screenings. We've distributed more than 50,000 glasses. Just last week, we completed a screening project in Ensawam with Honorable Frank Domfrey, his constituency, and with his partnership. And we screened 700 people there.
The screening exercise was conducted in collaboration with Total Vision, with support from Allianz Insurance. The Chief Operations Officer for Vision Spring, Lena Palav, told JoyNews more communities have been earmarked for such screening exercises.
What we want to do in Ghana is to continue some of these partnerships that we've built, like right here, NEMA, we have Total Vision with us. We have Allianz right here with us. Then we've worked with Kokoshe. We want to build on these partnerships and really touch at least 1 million people more in the next 2 years.
So that's details of that eye screening exercise, and today is World Sight Day. Just in case you didn't know, it's a good time to get your eye checked. And Collins Asmini is an optometrist. He's with me in the studio, and joining me via Zoom is also Dr. Jifa Bella Oforeje. She's a consultant pediatric ophthalmologist at the Kolebu Teaching Hospital, and Collins is happy that you're joining us. Dr. Jifa Bella, if you can hear me, I'm sure if you're on.
Yes, I can hear you, MFA. Good afternoon to you, good afternoon to Collins, and then to our cherished viewers.
Good afternoon, and World Sight Day to you as well. I've been asking Collins what we should be pondering over today as we celebrate World Sight Day.
Yes, so as he said rightly, World Sight Day is the second Thursday that has been set aside, second Thursday in October, that has been set aside by the IAPB, that's the International Agency for the Prevention of Blindness. And the main aim of this day is to create public awareness about visual impairment and then blindness, and to educate the public on the prevention of blindness. It was interesting, those statistics that you put out there. And the sad part is that all these causes are avoidable, preventable. Okay, except for glaucoma, all the other causes of blindness that we have currently are preventable. So the IAPB, the theme for this year is love your eyes. Anytime you love something, you cherish it, you take good care of it. And they looked at the 4 P's of how to love our eyes. The first one is it's prevention, so that you are supposed to prevent eye diseases from occurring. And we know that to be able to, most of these eye diseases, like I said, are usually due to avoidable causes. So living a healthy lifestyle, eating a balanced diet. A healthy lifestyle, we are saying that reduce your alcohol intake. If you're smoking, stop smoking.
That affects your eye? That affects your eye? Alcohol, smoking affects your eye?
Yes, it
How?
does. It
Tell
can
me.
cause optic atrophy.
That's right.
Okay, there's an optic nerve, which is a powerhouse of the eye. Okay, and even when you take in a lot of alcohol, you have certain mineral deficiencies, and it can result in what we call nutritional optic neuropathy. And that optic neuropathy is not curable. Once it occurs and you stop drinking, you can't bring the vision back. Okay, so we're talking about eating a balanced diet, but we know what we are talking about when we talk about balanced diet, especially vitamin A. Okay, we have our contomere, we have our spinach, we have our vitamin C, oranges, tomatoes, and then our vitamin E, the avocados, and then the nuts. Okay, and all these balanced diets helps you to be healthy. And once you are healthy, then you're not likely to get some of these diseases. And then we talk about protection of the eyes as well, protecting our eyes against harmful radiations. As soon as you step out of your house, you want to wear dark glasses when you are in the sun, okay? So you want to wear UV protected dark glasses to protect your eyes. And if you are a mechanic, a carpenter, a welder, and you're working, you want to wear protective goggles, because we see lots of people coming to the hospital with eye injuries because he's a carpenter and he's working and a piece of the wood gets into their eye. And it is the difference between blindness and having vision. There's a saying that of all the sights, the senses that we have, the sight must be the most pleasurable one. Yeah. Imagine a tiny piece of wood changing your life in one day. And all you could have done was to wear protective glasses. And now in the era of COVID, where we are encouraging physical distancing, most of our meetings are now virtual, isn't it? And with these virtual meetings means that we are spending a lot of time behind the screens, okay? And with a lot of time behind the screens, you are not blinking as much as you need to blink, okay? It's causing dryness in the eye, it's causing pain in the eye. And our children too are being homeschooled, okay? So we want to encourage children to play at least 1 to 2 hours outdoors, to protect the eye. Okay, and also the radiation, the intensity, the glare from the screen, you want to reduce the screen. And then the next one we talk about is preserving your vision. So you've prevented it, you've protected it. Now, how do you preserve what you
We'll come to the preservation shortly, because we need to talk about the statistics that we got from the Ghana Health Service. Also, it looks like glaucoma is leading there, followed by cataract.
It's
cataract leading, and then glaucoma. Yeah. Super. We'll get into it, but really, you had a screening for people in Nima, for instance. Yeah. What did you find in terms of your screening and interaction with these people?
Well, what we realized was that majority of the people were first-time wearer of glasses. What it means is that probably they were prescribed glasses in the past, and I mean, a lot of dynamics. Maybe they couldn't go for it. Maybe it was issue of cost. And so we found that almost 50% of the people that turned up were wearing glasses for the first time. And majorly, we had a condition we call presbyopia, which is what I would say a natural phenomenon. Once you hit age 40, it becomes difficult to see near print. And so when they came, we offered them reading glasses. But then it also tells us that people are not probably checking their eyes that much, and that somebody has to get to, let's say, 50 years before they get to know that they need glasses. Yeah, that was one of the things that we found out. There are other conditions like allergies, which I would say is a normal condition because of the environment and all that. And then we also found cataract and glaucoma also.
Okay, well, interesting then. Concerning this kind of screening and people participating in it, for instance, is it always a difficulty getting people to come out and get their eyes screened?
Well, I would say that the trend is changing.
Okay.
Because we had close to 500 people within just a space of between 8 a.m. and 4 p.m. And we even had to turn some people away. So I see that generally when it comes to screenings, there is this interest that is building. But I see the interest more in places where they don't have ready access to eye care. I think the whole of Nima, there's no eye clinic that is providing them the service. And so they saw this as a very important exercise for them to have their eyes examined.
So for you, you think that people are taking their eyes more serious than previously?
I would say so.
Okay, interesting. Doc, but this issue also about preservation, I think we can get into preservation at this point, then we can talk about the diseases that are leading in terms of eyes. I am short-sighted. I've declared my my assets right here. But let's talk about preservation. You've talked about how we can protect, amongst others. So you have to unmute, Doc.
So in preservation, we're actually talking about planning for and then getting regular eye checkup. So sometimes people just go and change their glasses. So nearsighted people like you go to the clinic and all they do is check their glasses, and we want you to have a comprehensive eye check. So you check your glasses, we look at your eye, and then we look at the back of your eye, which contains the optic nerve, which is affected when you have glaucoma. So we're talking about comprehensive eye screening. And then we are saying that prioritize your eyes. Okay, when you go for annual medical checkup, make sure that you're doing eye screening as well. And importantly for children, okay, some children don't know they have poor vision. Okay, most of the children, because they're not able to articulate their needs, like Colin said, presbyopia is for the aged, and for children, some of them may have refractive error, and it may be the only reason why they are performing badly in school, or the only reason why they are inattentive in school, and it's because they cannot see, and they are being branded as not being intelligent, and all they need is a pair of glasses. So if we are prioritizing eye screening, we are screening our eyes and that of our children. This year it says that love your eyes, and it says everybody counts, everybody including children. When you're going to check your eyes, you go along with your child. You screen your child's eye as well, because the leading cause of visual impairment in children is uncorrected refractive error, meaning that there are children who don't see properly. They see fuzzy, but interestingly, they think that is how we all see because they don't know any better. Yeah. It's only a few of them that can actually notice that their vision is not right. Okay. So screening is very important. Yeah.
But what are the basic signs, for instance, to look out for when you have children with you? At least, what are the basic things you can start doing at home for you to know that that child needs help?
Yes. So a few of the signs that children will have, okay? One of them is what we call the squint. So a child who squints, in our local parlance, we call it, I look me, I look London, okay? So one eye is straight and the other eye is deviated. When a child has that, it means that there's something wrong with the eye. The eye communicates with the brain holds the eye straight. And both of us now, our eyes are straight, it's because the eye is communicating to the brain. Anytime your eye is deviated, it means your eye is not communicating to the brain. And there may be several reasons why that is happening. For most children, it may happen in one eye, so the other eye is good. So they go about their daily activities. They don't have any pain, they don't complain. So parents see it as a cosmetic problem, not a visual problem, okay? And some children may also present with a spot in their eye. So this cataract that we're saying is the leading cause of avoidable blindness. You can have cataract in children too. And when that happens, they are not able to see. If it is in both eyes, you will notice it because the child may not walk. But if it's in one eye, then the child will be using the other eye. Occasionally, some children too will hold books very close to their faces when they are reading, okay? And that will tell you that there's a problem with the child. The American Academy of Pediatric Ophthalmology and Strabismus advises that when a child is born, the eyes must be screened at birth, must be screened before the first year of age, and must be screened before going to school.
But are we doing that? Do we have people doing that?
We are not doing that. We are not doing that, especially before school. I have personally had to see children who are about 12 years of age who cannot see at all, okay? And you put the glasses in their eyes and on their eyes and they marvel. Yeah. Is this how the door looks? Is this how this looks? They are amazed. And these children don't put down their glasses because they've begun to appreciate life for what it is. And then the parents get worried. They say the child is dependent on the glasses. A child is not dependent on the glasses. Everybody likes good things. So if you can see well with the glasses, there's no way that child is going to put the glasses away. And that also is another problem because then there's a misnomer that if you wear glasses, your eyes get sunken, okay? So the parents will prevent the children from wearing the glasses because they think the children are dependent on the glasses, which they are not. They are just happy with the new vision that they have. So you will notice that some children only take off the glasses when they are going to bed, and the parents must leave them to do that because they see better with the glasses. Remember, you say you're nearsighted, so you can imagine what it means for a child who is being forced to put the glasses down because mom thinks that the child is dependent on glasses. So those are some of the things that can help you notice that your child has a problem.
Okay.
Another emerging problem with children we are having now is retinopathy of prematurity. A lot of our preterms are surviving, and with their high survival comes issues with the immature eye. So anyone who has a preterm baby must screen that child within the first month of the child's life. Otherwise, it can lead to permanent blindness. And in this COVID era, where we had a few breaks in our screening of preterm children, we had few children who went completely blind from an avoidable cause, such as retinopathy of prematurity. So
Okay.
these children are not born blind. They are just born early. So we need to screen them.
Okay. Is it okay, Collins, that I can wear my glasses every day? Because it's surprising that I'm hearing that we should allow the children to wear them. They only take it off when they are going to bed. Is it okay that we wear it for that long period of time?
Yeah, in fact, we encourage full-time wear.
Okay.
For you to derive the best benefit from glasses, you must wear it full-time.
Does it correct it? Or
Well,
what exactly does it
the way glasses work is that as far as it's on your eyes, you are good. When you put it down, you are back to your old self.
Okay.
Because nature is also at play. Some people are born with longer eyeballs, some have shorter eyeballs. They all have, I would say, a consequence on how you see. So people who are myopes, like yourself, most of them may have longer eyeballs. And it's something that we cannot use glasses to correct it. But the glasses is only helping you so far as you put it on. If you put it down, you are back to your old self.
Okay.
And that's something that sometimes creates some misconception. People feel that there's some medicine in the glasses. As I wear it, it goes into my eye, and then with time...
Exactly, because that's what I thought. But going for glasses, I was told that when you wear it for a period, I've been wearing it since I was 16 or so, that at some point in time, I would have to stop wearing the glasses because it will correct my eye.
No,
not true.
It corrects when it's on your eye.
Only when it's on?
Only when it's on.
So I'll wear it for the rest of my life?
I'm afraid, yes.
No.
But one thing that I wanted to add is that, I mean, I don't think when I was 3 years, I was using iPad or anything. But now the trend is changing. You have 2-year-olds using iPads and all that. And there's a research coming up. I don't know. I'm sure Dr. Yifa will speak to it, where it's being found out that the more we are doing near work and ignoring far activity, that is also a cause of myopia or short-sightedness. Okay. And so that's why we are encouraging that kids should spend some time outside. The more you are engaging yourself in the outside activity, it excites the brain, and chances are that you will not have myopia.
Okay. Well, is there certain kinds of food? Are there any food that we should avoid so that we can be able to take care of our eyes? Is there, because I've been told that alcohol and then we need to eat balanced diets and all that. But some have said when we're young, we're told that if you eat too much gari, my father told me that I ate too much gari. That's how come I've ended up wearing glasses.
Right.
Is it true?
That is also a misconception. I mean, there's no correlation between high carbohydrate and refractive error. We also told the same thing, but when we learned the science, we realized that there's no correlation. What we know is that there are types of food that can help give you healthy eyes. I mean, we have all the greens, the vegetables, the fruits, and Dr. Ajifa mentioned kotomire. All of those types of foods help. Really, carrots are a very good source of nutrients that help the eye.
Okay. Well, Dr. Ajifabel, I'm sure you would want to add some more to it. There's misconceptions about the high carbs, high starch that affects your eyes, and the kinds of food in particular that you need to have more intake of to be able to help your eyes.
Basically, like I said, a balanced diet, okay? So these high carbohydrates, they are indirectly affecting your eyes because, say, if you're taking high carbohydrates or if you develop, say, obesity or you develop diabetes from that, okay, then the sequelae of the diabetes is the eye problem. Or let's say you have a lot of cholesterol, then the sequelae of the high cholesterol is what is going to affect your eyes. So basically, a balanced diet is very important. Once you eat a balanced diet, then your eyes will be healthy, your body will be healthy, and then your eyes will be healthy. One of the examples I give my patients' parents about glasses, when you said that you felt that it will cure your eyes, I said to them that you wear high heels, you are short, and when you take off the heels, you go back to your height, right? But when you wear it, you feel very good, and it's the same thing. So once you wear the glasses, you can see everything clearly, but you take it off, then you can't see. And the problem in children is that children usually are not born with excellent eyesight. The more they see, the better their vision. Okay, so when you have a baby who was born today, their eyesight on day one is different from their eyesight at 6 months. Okay. So the more you see clearly, the better your eye develops. So imagine that child who is nearsighted and is not wearing glasses and is seeing blurry. for the rest of that child's life, the brain will understand that everything in life is blurry. And we say children become visual adults at the age of 8 years. So if you don't correct this refractive error before 8 years, you put on the glasses, but you still won't see. So if I imagine your eye without the glasses and with the glasses, and I'm saying that if you prevent children from wearing glasses or you prevent them from having good eyesight before a certain age, they develop amblyopia, their vision will remain bad for the rest of their lives. So for me, it is important that parents understand that when your child needs glasses, like he said, full-time glasses wear. If it is not full-time glasses wear, in certain circumstances, you'll be told. But by and large, for majority of them, you need full-time glasses wear.
Okay.
And this week, Ophthalmological Society of Ghana has been in Cape Coast doing a lot of cataract surgery. So at the Cape Coast Teaching Hospital, we partnered with the Himalayan Cataract Project, and we screened over 500 patients, and over 200 surgeries have been done so far in commemoration of the World Sight Day. You saw that cataract was a leading cause of blindness, and it's preventable. Okay, there's a video where the first day after the cataract surgery, patients were helped into the facility because they couldn't see. First day after the surgery, the plaster is taken off their eyes, and then they are seeing and they are excited because this mother who couldn't work can now start working. This mom who couldn't go to the farm can go back to farm. And in that way, you are improving the life of the caregiver, and the children are going to have a good life.
But what causes it? Cataract. Let's get into it.
Cataract, they are mainly is age-related. So basically, you and I, when we clock 50 plus, we are going to start developing cataracts, okay? In children, some children may be born with cataract. That is called congenital cataract. But cataract is age-related. If you live long enough, you will develop cataract. There are certain disease conditions that will make you predisposed to developing cataracts early. One of them is diabetes. So if you have diabetes and your sugars are not well controlled, then you have a tendency to develop cataracts early. And there are certain patients who have certain diseases that we put them on what we call steroids. And that steroid can also trigger cataracts early. And that is why we advise against buying over-the-counter drugs, because some of these medications contain steroids. You buy them and you continuously put them in your eye, and within a short period of time, you see a 35-year-old man developing a cataract. So cataracts, by and large, the greater percentage of it is age-related.
Okay, Collins, is there a way that we can actually, we know it's age-related, but is there anything you can do to minimize you getting it, or is there anything like that?
Well, it's difficult. My dad had cataracts. I wish he didn't have it, but I would say it's age-related, and so the more he grew, he had it, and so had to undergo surgery. But what can be avoided, I would say, is the one caused by trauma. So we advise that, I mean, kids, kids who play outside can get hit by the ball they are playing. I mean, very, we'll call it blunt trauma. And that can result in cataract.
Okay.
Yeah, so cataract can come as a result of trauma. And that is what I would say is avoidable. So maybe parents will have to be on the lookout. And then people who want to engage in even contact sports sometimes, playing lawn tennis and all that, if you are hit in the eye, that can cause cataract.
Okay, so we've talked about trauma then. Are there any other signs that we need to look out for you to know that this is cataract or this is glaucoma? Maybe we should just finish with cataract, then we can go into the other ones. Are there any signs that you display when you have cataract? Or is just that it just comes, you don't see anything?
So cataract, usually you see a white pupil. So when you look into someone's eye, there's a little hole in the eye that looks black. And in cataract, that hole becomes white. So they'll see a white spot in the eye. That is in the advanced cases. Now, in the early stages, it may just present with poor vision. So your vision is reduced. And early stages, most of the time, glasses would help. So when you do refraction, okay, and you're putting glasses, your vision gets better. So poor vision is one of them. And then the white spots that you see in the eye. And then the patients will say that the thing looks cloudy. When they are looking at things, it looks cloudy. So that is one of the things that you can know that you have cataract. But the good news about cataract is that It is once you get it, we do the surgery and then you can see.
Is it a painful exercise?
Is not so much.
Is it painful?
Say again.
The surgery, is it painful?
It's usually done under anesthesia,
Okay.
so you won't feel the pain. So usually the same way when you go to a dentist, you know they give you the numbing injection before they do the extraction of your tooth. So it's a similar injection that we give under the eye. And then within 30 minutes, you are up. And then the following day, voila, you can see.
You're good. Okay, so I see others also asking, Collins, for instance, that if I'm wearing glasses,
right,
and I give birth, is it automatic that my children will also have to wear glasses? Because I have a girl, she's wearing glasses. My son is not.
Right.
Is it that I should wait? My son will also be wearing very soon. Is it genetic?
Yeah,
can I always transfer?
We have found that refractive errors can be inherited, and particularly in the case of myopia. In fact, we went to do some screening in Sawam somewhere 2 weeks ago, and a family of 4 all wear glasses. I mean, it's interesting that the mother and 3 daughters all wear glasses, and so you would find that can happen, especially in the case of myopia.
Okay. Yeah. So, Doc, once I'm pregnant, was there anything I could have done to prevent my children getting it? Like I said, my girl has it, my boy doesn't right now, at least. Maybe we haven't checked. But is there a way that I can prevent it once I'm pregnant so that they don't get it?
Not really, MFA. I'm sure your daughter has your nice skin, right? So she took lots of the things, including
why the myopic? Why did she take that one?
I'm sure she took other things as well. She took other awesome things as well. But you see, the good news about being myopic is once you're wearing your glasses, you are as good as those of us not wearing glasses, okay? Yeah. So with the glasses, your vision is perfect. We worry when you wear your glasses and your vision is not perfect. Okay. And that is where I say that in children who don't wear their glasses early, that can happen. They can develop amblyopia, whereby even when they wear their glasses, they can't see properly. So just imagine yourself in high heels the next time you worry about it. You look tall, you are happy. She wears the glasses, she sees, she's on top of the world. She can achieve anything with the glasses. So wearing glasses in itself or being myopic in itself is not a problem. Okay. So long as you're in your glasses, you are okay.
Well, and then also my producers are asking that if you have cataract, can you also get glaucoma? Can you get all the eye diseases at the same time? Is there a combination that always comes?
So cataract and glaucoma are completely different. So glaucoma happens in the middle of cataract happens in the middle of the eye, and glaucoma happens at the back of the eye. So glaucoma affects the powerhouse of the eye. The eyeball is connected to the brain through a cord, okay? And that cord sends all the impulses to the brain. So in glaucoma, that cord gets damaged. So the eyeball may be fine, the brain will be fine, but the transmission, once it is damaged, then you have issues. So you liken it to having a new television set. Okay, you need to connect it to the powerhouse to be able to get electricity. Okay, so if between the TV set and the Akosobo dam that is producing the electricity, there's a plug between it. That is the cord for the glaucoma. The TV set may be new. If you don't connect it to the power, you will not see. In this case, the Akosobo dam. So if you have glaucoma, everything about your eye can be fine. Just that cord that gets damaged. And that is what will bring the poor vision. And unfortunately for us, glaucoma is irreversible. Poor vision in glaucoma is irreversible. So glaucoma is actually the leading cause of irreversible blindness. The same way cataract is the leading cause of reversible blindness. The issue with glaucoma is it doesn't give you any signs at all. So it starts, we call it the silent thief of sight, because it starts from your periphery. So your central vision, which is what you're using to look at me now, will be perfect. It will encroach from the periphery, and by the time it is advanced, it will affect your central vision. And that is the stage where most people would notice that something is going wrong. And that time is too late. So for glaucoma, we're saying that get your eye checked. Anytime you go to the hospital, your blood pressure is taken, whether or not you are hypertensive. This is to tell you that you are hypertensive or you are pre-hypertensive or not. In the same way for glaucoma, when you visit your eye doctor, your ophthalmologist will check the pressure in your eye. And that is what will tell the doctor to get worried or not. And then they'll look at the back of your eye as well. And then they'll be able to tell whether you are at risk of developing glaucoma or whether you have glaucoma or not. So the only way to prevent this irreversible blindness is through screening.
Okay. Well, Collins, there are those who don't like the glasses, but yeah, they admit that they need to correct it. Lenses, we wear contact lenses sometimes.
Right.
Does it have any effect? Is it okay to opt for contact lenses, and how long can you keep on wearing it?
Well, I would say contact lenses have been around for some time. They are in vogue, but it comes with its own issues. And so doctors would normally do an assessment. In fact, my lecturer told me that if you walk into his office and he saw that your nails were not well kept, that just it disqualifies you
from wearing
contacts, because the point is that it can easily get infected, and you know, when it's infected, there's bacteria. I mean, it's one of the leading causes of visual impairment in the United States. So people who wear contact lenses and have some infection, it can really, because it has, you know, it's put on the cornea, and the cornea is the most sensitive part of the body, and so that can have a lot of issues. But so many people are wearing contacts. We would encourage people to wear them, and it looks like ladies do well with contacts. Yeah, so for me, I would encourage.
But now it's scary. Yeah. Well, Doc, we should be wrapping up. Maybe a word or two also on contacts. Sometimes you want to drop the glasses and then just put on contacts, so it will be like you as well. Is it okay?
So just like he said, apart from the cost implications is one of them. So there are some of them that are not for long-term use, but because people can't afford them, they tend to wear them for long-term use. If you don't get an infection, you'll be fine. But when you get an infection, it is very difficult to treat. And if you don't treat or if the infection becomes severe, you get cloudiness in your cornea and you may need a cornea transplant. So by all means, you can wear contact lenses. There are some children that you don't have a choice. They have to wear the contact lenses.
Okay.
But when you have a choice and you're wearing contact lenses, you should make sure that you are as clean as possible. You are abiding by the rules of the contact lenses. If you're supposed to wear it for a week, you make sure you wear it for a week. If it's a daily use, you wear it for daily use.
Okay.
In this one, you can't do economics.
So if it's a monthly use, for instance, you have to keep it on the whole month, or you have to take it off every day?
So if you take it off, there's solution that you put it inside. It comes with all its regulations. And like he said, you need to wash your hands before you wear them. The only problem with contact lens is because when there is an infection, it's very difficult to treat. Okay, because of the kind of bacteria that causes the infection. Otherwise, contact lens is actually not a problem at all. Okay. So in the Western world, where they get the contact lens on insurance, there's no problem of wearing a day's contact lens for a week because you have tons of it. Okay, so you don't tend to have issues like that. But in our setting, when the cost is prohibitive as well, you should adhere to the regulations, because if you do get an infection, it may be potentially blinding.
Okay, thank you very much. Dr. Jifa Bella Oforeje, she's a consultant pediatric ophthalmologist at the Kolebu Teaching Hospital. Dr. Collins Asumeni, an optometrist, also in the studios with me. Maybe quickly, my eyes, are they good?
Yeah, they look good.
Okay. Thank you very much. And that's it for this particular segment. It's World Sight Day. Ought to take care of your eyes. Love your eyes. They are all that you have. And we'll take a quick break here on The Pulse. We're right back.
Thank you.
Thanks for staying with us here on The Pulse. It's time to take a trip to my beloved Volta region. But heavy rains amidst serious windstorm hit the Tafi Atome on Thursday, causing damage to houses. The renowned Tafi Atome Monkey Sanctuary, the windstorm uprooted very old trees in the grove, which serves as the homes of these monkeys. We'll be hearing from the manager of the place shortly, but first, Maxwell Abagba was there earlier and reports that monkeys in Tafi Atome are considered sacred and residents are urged to treat them as humans.
Some students of the Tafi Atome LA Basic School doing the Obrim dance to welcome the JoyNews team to their community.
My name is Michael Jandu.
Michael Jandu is the choreographer who taught the students the Obrim dance.
The Obrim dance is a kind of dance our forefathers used to dance, especially when it is like engagement occasion and marriage occasions.
Okay.
So when they are dancing, they move in pairs. How they dance in pairs and they make chairs. They share with each other.
The lush green vegetation of Tafi Atome provides a serene environment for residents and visitors. But the monkey sanctuary in this community is what is serving as the biggest attraction for many people who visit Tafi Atome. Francis Akwe told me the monkeys came to settle with the people of Tafi Atome when their forefathers migrated from Asin in the central region to their present location. Francis says revenue generated from visit by tourists has contributed significantly to the development of Tafi Atome. Some of the funds have been used to support the construction of a community library, ICT center, fencing the community clinic and more. Monkeys are considered special and sacred in this community such that some of them are buried in special tombs. One of them buried on the sides of the road in a tiled tomb, I'm told, was knocked down by a speeding vehicle.
We understand that the people used to worship the monkeys.
Yes.
Can you tell us more about that?
Yes, because the gods said they were messengers from them to the people. The people began to worship God through them, by regularly pouring libation, protecting them, the gods gave them taboos to observe, to actually safeguard the animals in the grove. Some of these taboos were we as people of Tafi, we are forbidden from eating the meat of monkey. We're forbidden from eating the meat of reptiles. We are forbidden from eating the meat of tortoise. As when you are a Tafi, you eat any of those animals, then you commit a crime, you commit a taboo. I mean, you break the taboo of the land, and so there is a penalty that will be meted out to you.
Okay.
Yeah.
Okay.
For example, out of the money we realize from this, have helped us to build a clinic for the community.
Oh wow.
Yes, there is an American philanthropist called Amanda. She came here to help us build a computer lab, a library, and a nursery for the kids. Part of the money from this project went into supporting her project to come into reality.
You know, we all know monkeys love bananas.
Yes,
when we
yes.
came with bananas, I saw how they were all over us. Can we get some bananas so we can feed them? Let me. Oh my God, this one is. I'm sure he's gonna jump. Ah. Oh wow. Okay. Oh. Why do monkeys love bananas? Can you? Are you able to talk?
Monkeys eat a lot of fruits, like avocados, mangoes. You know, they feed on insects. They feed on leaves. But to be frank, bananas are their favorite.
Okay.
Among all the food they eat, bananas are their favorites.
Wow.
And so there's no way you set a trap with a banana that a monkey will not fall in.
They love bananas too much. Oh, they should come. Yes.
That's the sound of the king. At
this
time,
really?
Did you hear?
Yeah.
It will sound again the second time.
Okay.
And after the second time, each troop leader will respond by saying,
Really?
Yes. It means it wants to know the whereabouts of each troop at the moment.
Wow. Yes. That was very true to you. Is it that big? So that's it.
Yeah. No, it's not the one that made the noise. But he's a leader to this troop here.
Okay.
So he is responding to the sound.
Okay.
By this time, if you should be in the center of the village, you will hear this very sound from different junctures of the forest. Then you know where the monkeys are at the moment. That sound, you hear that sound too?
Yeah.
It means it's a female that is on heat.
Okay.
You hear again?
Uh-huh. So wait, this sound is a female on heat.
Oh. You hear again?
Yeah.
Did you hear that?
Yeah. What's the meaning?
The overall king of all the monkeys.
Yeah.
Wants to know the whereabouts of each troop.
Meet Rejoice Tovinho. She's in charge of the Tafi Atome Chips compound. She has been talking about some of the enormous benefits of the monkey sanctuary to the community.
I learned formally the people over here walk like 12 kilometers to other places for their healthcare services. But once the place has been established, they are no longer going anywhere. We usually take care of their healthcare services.
Okay.
Yes.
Okay. Okay. And then pregnant women also come here to deliver?
They come here to deliver.
Okay.
They usually have visitors that do visit the monkey sanctuary.
Okay.
And please, have you seen this nice fence?
Yeah.
The fence of the facility is being put up from the monkey sanctuary.
Okay. From the money?
From the money that they generate.
Okay.
From the monkey sanctuary or from the visitors.
Paul Bologa is a blacksmith. He says they consider the monkeys to be part of them as such. They treat them well. Sometimes they come to our house. We feed them and give them food. We do not hurt them. They are also our children, he said with a smile on his face.
And that's a sight to behold. Maxwell Ababa with that report from the Tafi Atome Monkey Sanctuary. Unfortunately, there was a storm that has wreaked havoc in the area. Let's speak to the manager of the Tafi Atome Monkey Sanctuary. Joins us on the line. We are grateful for your time, Francis. Welcome to the polls. So tell us about the extent of damage caused by this rains over the period.
Yeah. Hello?
Hello, Francis, we can hear you. So I'm asking about the extent of damage caused by the rains. Tell us about it.
Thank you very much. In fact, yesterday at about 3 o'clock in the afternoon, the clouds were setting for rain. And all of a sudden, this heavy rain downpour began to happen. And there also came heavy windstorm, which actually destroyed a lot of things in the community. Firstly, in the community, most roofs were taken off.
Okay.
And many mud houses also collapsed. Then at the office area, the tourist reception area, there are trees surrounding the newly rehabilitated office by Ghana Tourism Authority. Those very huge trees surrounding the office all fell. The roofs all got uprooted. Luckily, they did not touch any of the buildings to cause any much havoc at the reception side.
Okay, but Francis, is it the first time that you're witnessing such a situation?
Yes, please. Since I was born.
Oh, well,
I haven't witnessed this before.
Interesting. There are some who are of the view that could it be that because you highlighted what it is that happens at the sanctuary for the whole world to see, that's how come this could be. Could we rule out superstition?
No, that is not true. I don't believe that.
Okay.
But it's a natural disaster that has happened.
Okay.
Yes. And this when the windstorm went ahead to enter the forest itself and brought a lot of big trees down, making the forest look very bare now. In fact, when you come to portions of the forest right now, you wouldn't believe it was the same thing one saw a few days ago. The monkeys are suffering now. We are lucky some portion was not destroyed.
Okay.
That is where
so we can safely say that the gods are not angry.
Yes, the gods are not angry.
Okay.
Because the rites are performed accordingly.
Okay.
And so
we're grateful.
They're not angry at all.
We'll leave it here. Thank you very much, Francis Akwe. He is the manager of the Tafi Atome Monkey Sanctuary in the Volta region, in Tafi in the Volta region. Remember, we're heading to the Volta region for the Volta Fair, which is happening from the 15th to the 28th of November, and all roads lead to the Volta region. Visit Volta and experience Ghana. We're right back on The Pulse with sports. And that's it for this afternoon's edition of The Pulse. Let's Talk Entertainment, or Let's Talk Showbiz, is up next. There's more news when you log on to myjoyonline.com. From entertainment, business, all the way to sports. You can get the stories right there on myjoyonline.com. I am MF Apau. Thanks so much for your company tonight. Let's Talk Showbiz.